So if you had planned, for example, to have a childbirth without any pain medication, and you went through the classes and you have done everything, but your labor is not going as planned, sometimes it happens. Sometimes it happens that nothing goes as planned. You kind of develop your own birthing plan, and then everything goes through the window. And what do I mean when I said everything goes through the window? Your baby is not tolerating the contractions. We see that the baby is not happy, or your contractions are not making any change. You're not dilating, although you're having mild contractions, but they're not doing the work. And you sometimes will need some type of assistance once you are in labor to get you to deliver. What are those things that they do in the hospital setting? Is they give you medication, a medication called Pitocin. Pitocin assists you to bring contractions to a strength that will cause you to dilate. If there's no dilation, if the baby is not pushing with enough force, the cervix is not going to dilate. So you might require some Pitocin to, augment your labor. Another thing that can happen, not as planned, is that you get to 40 weeks or 41 weeks and you are not starting contractions, which happened with some people. You will be given a date for an induction. An induction is when you come in and we induce your labor pain, meaning in the hospital setting. If you are planning to do naturally, what you can do to help yourself to become or start the contraction, because your body at the third trimester starts doing what is called the Braxton Hicks contractions, which are the false labor contractions that will cause your cervix. It starts training your cervix to dilate and to, kind of soften. So if you have none, which some people do, you might require an induction. If you have some contractions, what you can do to enhance them and bring them closer together is like, go get a massage, a full body massage where they do the meridian points, where they can stimulate your ovaries and your pituitary gland to secrete Pitocin naturally, and that can put you into labor. So, and other things that you can do, which sometimes they don't recommend, is have sex. The sperm is irritating to the cervix, and that causes contractions. Okay, so, and if you're already contracting, then it'll kind of intensify the contraction. Sometimes they go away, sometimes they just get stronger and you go into labor. So you can try a few natural things, that can help you with that.